This is Lily Hassan with her disease presentation. Today my presentation is on Lyme disease. Please don't make fun of my horrible autistic abilities on this whiteboard for most of the video. First of all, what is Lyme disease? Lyme disease is a bacteria which the main carriers of this are found in, wait for it, the worst bugs ever, ticks. Yes, I said that correctly, ticks. And they are the main carriers. The first case of Lyme disease was first noticed in 1970. This disease was first noticed in a bunch of school kids and young adults. Now, the first symptoms of Lyme disease were first noticed in Connecticut. Ironically, the town that the first case was in was Lyme, Connecticut. Even though the disease was known about, the first case wasn't diagnosed until about the mid-1970s. In 1981, a scientist who was then studying Rocky Mountain fever linked the cases and symptoms to the deer tick. One of the most common symptoms of Lyme disease is a rash, or commonly known as a bullseye rash. This occurs where the tick latched on. Now, the rashes can vary in size and shape, all are not exact. Another symptom is fatigue and headaches. This is reported in a lot of cases with children and adults that have started to see signs and symptoms of Lyme. For adults that are experiencing fever, anything considered or above 100.5 degrees is considered a fever, and anything over that is extreme and you should go to your emergency room immediately. But for children's cases, anything above 98 degrees is considered severe. This is commonly seen with Lyme disease because it is your body trying to fight off the bacteria. Now, some late symptoms that, if Lyme disease is left untreated, can presume to these are swollen joints, more commonly known as Lyme arthritis. This would have to go prolonged without being treated and can be very chronic and damaging to the body's joints. Now, starting from when the first case was officially diagnosed in 1981, currently since the 2000s, there has been over 400,002 cases diagnosed in the US alone. That is drastically increased since. Now, the main treatment for Lyme is just for your body to fight the bacteria. Also, antibiotics can be prescribed by your doctor. Some of the antibiotics that can be prescribed is penicillin, which is a non-steroidal anti-inflammatory, which is caused by the bacteria from the tick that is within one's body from Lyme. And some anti-inflammatories can be prescribed or bought over the counter. Now, what are some of the best preventions of getting Lyme disease? Because there is a few steps one can take to avoid such a horrible disease. Now, some of the products you can use is Deep Wood Off or any mosquito repellent. Most mosquito repellents contain tick repellent in them now. You just simply spray it on your clothing, mostly by your legs where you'll be walking and trying to avoid tall grassy areas or woods is the main areas where ticks will hide, and they can latch on your clothing and then later latch onto your skin. Now, the video materials, the voiceover was done by Lily Hassan, myself, And all of the images used in the video are from Google Images at www.googleimages.com.